All right, we're gonna talk about your pelvic floor. This is a female pelvis model, so do not have the penis here, apologies. So what I want to talk about is first the organs. In this model, we obviously have your bladder, looks like this. This is your uterus and this is your rectum. They sit like this. Okay, and I also want to bring attention to the fact that, again, the rectum and the bladder, they look like this. And what I want to pay attention to is if you are constipated or you're not having regular everyday bowel movements, that your bowel movements can basically build up and kind of push against your bladder, which can cause increased urinary frequency or increased urge to urinate. Okay. Going forward, we're going to look at the bony model itself. So this is one side of your hip or pelvis, and this is the other side. They're both called iliums. This is your lumbar spine, and this is your pubic bone, pubic symphysis, and then this is your tailbone, okay, or your sacrum. And so I'm gonna flip it around so you can see the back side, but I like to note that the back of the tailbone, or the end of the tailbone called the coccyx, attaches actually to the pelvic floor. It's connected, surprise. As well as, again, the sacrum and the ilium connect, and that's what makes up the SI joint. So I like to talk about that. Okay, if we are looking at the muscles itself, this is if I were to take away the layer of the skin, we see what's called the superficial layer of the pelvic floor. In this 2D model, that's what this is. And so basically that top of the triangle, bottom of the triangle, they make up the superficial layer of the pelvic floor. Just like to point out any big things that I see. Basically, we see the anus, the vaginal opening, and then the urethral opening where you urinate, and the clitoris, okay? And if I were to take that away, there is a deeper layer of the pelvic floor bowl, and you can look at that on that end as well. And I just want to note again that the sacrum and the end of the sacrum, the coccyx, attaches and is connected to those pelvic floor muscles. So if you are feeling tailbone pain or it hurts when you sit on certain surfaces or things like that, you could be needing pelvic floor, and so that's why you're here. In terms of pelvic floor mobilization, pelvic wand mobilization, you can use something called a pelvic wand. It looks like this. And so I'm going to show you on this model and this model, depending on which one's easier. You may use the 2D model. So you will use this end. It's a little bit pointier, but just for the sake of my model, I'm going to use this end. So if I were to go from the entrance of the vagina towards the deeper area of the pelvic floor muscles, you can see here you're going to reference the pelvic floor like points on a clock. So this would be your bottom and this would be the top, or where your pubic bone would be, okay? So I'm gonna face it as if you were laying down, okay? So if we were to insert the wand as such and I go straight down, you're gonna go towards 6 o'clock, okay? And if you reach far back enough, it might feel a little poopy. That might be that you're close in on the rectum. So back off just a little bit, okay? But I wanna remind you to don't bruise the tomato, but if you need to a little bit, you're not gonna hurt anything. Nothing bad's gonna happen. Okay, so going back to it, we're thinking about 6 o'clock is here down towards the rectum, and then 12 o'clock is up towards the bladder or the pubic bone. So if you're laying there, it's gonna be right up at 12. So I want you to go like points on a clock, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, okay? That's what you're gonna do, and you're going to go slow, and I'm gonna take this out and I'm just gonna show you via with the wand. You're just going to put pressure on those muscles, and I want you to think about little by little, right? So we're not going to here and then move to a different place. You might miss something. So you're gonna go one place and then you're gonna barely move one place here and then the next. So hold pressure for 5 to 10 seconds, and then you can move on to the next spot. But I want you to breathe through it, use that diaphragmatic breathing that we talked about. And if you want to go crazy, try it with the arms, those snow angel arms that we talked about as well. You can do that. But again, what I want you to think about is kind of going onto the muscle where you feel that tenderness, breathing through it, and you can also add some pressure and then kind of take up the slack of the muscle. So make it 3-dimensional. Instead of just pushing on it, you're adding maybe a diagonal or a down glide to that, and you can see if there's any tension there. Again, just hold for about 5 to 10 breaths. Really want you to focus on down regulating your nervous system and really helping these tissues relax. And you can do this maybe every day or every other day as prescribed by your pelvic floor therapist.